What is appropriate touching during a physical exam? The news has been reporting more and more on women coming forward with allegations that their physician has sexually assaulted them during a physical exam. And the law in some states says this is not a criminal offense, but rather these women are victims of medical malpractice. So I want everyone to learn today what is considered appropriate touching versus inappropriate touching while we're examining very sensitive areas. This is very important information. First up is the pelvic exam. Now let's make one thing very clear. Nobody should be touching the clitoris during a pelvic exam. So here's a diagram of the female external genitalia. Here I've highlighted the head of the clitoris, but the clitoris actually extends all the way up here. It's actually much longer than it looks on the outside. Now, if for some reason the clitoris needs to be examined, the proper technique is to put a thumb way up here and then retract the skin. But nobody should be directly touching the clitoris. This is the opening to the urethra. This is where we pee. This is where we pass urine. And this here is the vagina. This is where the pelvic exam is done. This is where the speculum is placed. And this is where we do pap smears. This entire thing put together, the entire appearance of the outside is actually called the vulva. Not the vag, not the vajayjay, not the vagine, the vulva. The vagina is inside. This is where we do the pelvic exams. Okay, now here are some examples of appropriate physical exam techniques that may be used during your pelvic exam. Number one is the bimanual exam. Now the bimanual exam is when we place one or two fingers into the vagina and then use the other hand on top of the abdomen. And this is to feel the ovaries and the uterus. Again, we're not touching the clitoris. Sometimes your doctor may need to do a rectovaginal exam. This is a side view of the female anatomy. This is the bladder, vagina, the uterus, anus, and the rectum. A rectovaginal exam involves gently inserting one finger into the vagina and one finger into the rectum. And there's a sweeping motion back and forth with the fingers, and that's to feel this area in between the vagina and rectum. Now, sometimes we need to feel this area here on the labia, and this is where some of your glands lived. And so sometimes we'll need to feel this area by gently pressing them with finger pads. Proper palpation technique is always done with the pads of the fingers. We don't use whole hands. There is no grabbing. There is no reason to rub anything. Nothing should be fast or rapid. There are no in and out motions. Now you're armed with knowledge to protect yourself. And just remember, if something feels off, trust your intuition. Coming up next, the breast exam.